Hi, I'm Randy Alvarez, host of the Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what you need to know if you're considering dental implants. My guest here says no more dentures. With as little as 2 dental implants, get something to help fix your teeth in your mouth, snap in, snap out. With us we have periodontist Dr. Levine. Okay, you brought some models.
I have some models here. What I'd like to show you first is what we can do with as little as 2 implants. And we went over this before we talked about Grandpa.
Okay, but these are the different options for denture wears.
But I can tell you that we have technology today. Now here's a model with just 2 implants, and it's very, very difficult to remove these.
Okay, let me see this again.
Go ahead.
Because I couldn't get it out the first time, and I thought, you know, it's going to look phony like I couldn't
grab it from the back.
Okay, so if you grab it from the back, you're okay. I got it. Okay.
You got to be okay.
Do people sometimes have a tough time taking these out of their mouths?
Well, that was one of the problems we had with Grandpa.
Okay.
Because he had arthritis. We had to actually loosen the attachments so we could get them out.
Okay, so that's 2. If there was a try-in period, you said, you know, where all the denture wearers in Florida come in and get 2 implants, they couldn't go back. You believe that?
They would never go back because people don't know what they're missing. When people have dentures, their chewing efficiency is about 20% of when they used to have natural teeth.
All right.
And I've never in 25 years did a dental implant procedure for somebody who said, gee, they were sorry they did it.
Okay.
They just say...
Is this, and I'm sorry to interrupt, is this one of those things where they say, I should have done this years ago? That means when it's all done, they go, why did I wait so long?
Well, you know, before you interrupt me, I was going to say, the next statement would be, I should have done it years ago.
Okay, all right.
Now, we have procedures today where a patient can come into my office with a loose-fitting denture. And we have technology today working with their general dentist that we can take that denture and in one day I can put in a number of implants so that denture can be converted to a fixed prosthesis by the dentist in 1 or 2 days, immediately after surgery.
Okay.
So I'm going to show you another model. This is a model with 4 implants, and this implant model is a removable denture. But today, with the technology we have, we could take those 4 implants and have them support a fixed prosthesis in 24 to 48 hours.
Okay, so this one is really, so like somebody watching this,
right?
Denture wear.
Correct.
And if they go in and, you know, if everything goes right, even if they're 75 years old, in a month from now they could have these, you know, be eating with this. Is that correct?
Depending on the procedure we choose.
With an ideal situation?
An ideal situation, they could have a fixed restoration in 24 to 48 hours.
Is that right?
That doesn't come out.
So they'll have teeth next week.
They'll have
eating and chewing.
Absolutely. Eating, chewing, dancing, going to the movies, whatever they want to do.
Okay, but the part I don't get though, you know, and I said that if it's as good as you say it is, why isn't everybody doing this? I guess the denture wearers don't go to the dentist anymore. Well, so nobody's telling them to do it. Is that part of it?
That's an unfortunate thing. Even patients who have dentures should be going to the dentist periodically.
Really?
Because as we get more mature, as we get older, our body changes. There's no part of our body that doesn't change. As we get older, when you wear dentures, the dentures exert pressure on the ridge, it causes bone loss, and then you have a denture that's loose. When the denture is loose, it causes more pressure on the ridge and more bone loss.
So when the denture becomes loose, it's because, it's not the denture, it's because they're losing bone, you say?
Correct. And the loose denture causes loss of bone, more loss of bone. So let me show you what this looks like.
All right.
This is a lower jaw. When patients have teeth, the jaw has this dimension. When teeth are gone, there's no stimulation to the bone, and just like other bones in the body, you get resorption. So over the years, you go from this to this to this.
Interesting.
There's no mystery as to why the lower denture doesn't fit. It doesn't fit because there's no bone support. Gravity doesn't help.
But you can still help that person?
We can still help this person. This is approximately the size of Grandpa's jaw when I got to take care of him 25 years ago. Now, truth be told, sometimes we need to build the bone. And we can build the bone today much easier than we could have years ago because I have bottles of material. I can build the bone, and within a relatively short time, the bone is solid, and we can use that bone to place implants.
Okay, okay. And their face, you say, sinks in with dentures over time.
Well, let me show you a lady that I took a picture of about 40 years ago. I met this lady when I was teaching at the University of Florida in Gainesville. And she came in as a very, very happy lady, and she was very self-confident, had a wonderful social life. But I want to show you a picture of the same lady without her teeth.
Wow. It's like an old, old woman.
That's an old, old woman who looks sort of like a witch. She has
Interesting.
She has a depressed mouth. She has jowls. Her chin sticks out. And this is like the caricature of the witch that we see. So we can change people's lives. And if we can change people's lives in a relatively painless and timely fashion, that's a wonderful thing.
But of course, you're a dentist,
Sure.
periodontist,
Right.
and you think the smile's probably one of the most important things, right?
Of course I do.
Okay.
But I have to tell you that it's important to everyone. Because when someone walks in the room, all their body is covered except for their face. And you see their smile.
Right.
Let me tell you about Jimmy. Jimmy is from England, and he's a soccer player. And he came in one day, and this is how he presented to me. And this is a close-up of his mouth.
Oh, boy.
And I have to tell you, patients wonder whether dental implants and teeth on dental implants look natural. Well, here's Jimmy.
I guess you can't tell which one is which.
You know, if I didn't know, I couldn't tell you, and as a dentist. And here he is a year later.
So you even made it a little bit yellow at the top.
You
So
make
the
it
color
to,
and everything is...
You make it to match the teeth.
Interesting. Looks happy.
And this is about 3 years later.
Okay.
So he is very, very happy. You know, he's single, he's out in the public, he's in business, plus he has a social life.
So what's the alternative, by the way? Okay, so if he didn't get dental implants, what would be going on?
Okay. Well, the old alternative was a removable partial denture. And what the removable partial denture does is rest on the adjacent teeth and causes loosening of the teeth and wearing away of the bone.
So what is the alternative for somebody? Okay, and how is a dental implant better than what traditional dentistry offers?
There are a lot of benefits to the dental implant. The alternative today to a dental implant is a fixed bridge, and many of my colleagues place fixed bridges every day, and they function well. But there are benefits to the dental implant. When you do a fixed bridge, you have to grind down the outside surface of the adjacent teeth. So those teeth are prepared, and part of the tooth is removed. A crown goes over each tooth, and there's a bridge that's suspended. That's called a fixed bridge.
Okay.
Statistics in the United States show that those fixed bridges last somewhere between 5 and 10 years, and they fail. They fail because they become loose, decay. When that occurs, then you start the whole cascade of root canals, additional bridges, additional teeth, and the 3-tooth bridge sometimes becomes a 4-tooth bridge, a 5-tooth bridge.
It's like a snowball.
It's a big snowball.
Now, when I see metal clasps, this probably is...
The metal clasp,
what am I looking at there?
What you're seeing is the clasp of a removable partial denture. That's used to replace one, some, or many teeth. The problem with those appliances is that they lean on the teeth. They cause wearing away the teeth and the gum, and then more teeth become involved. I would love to see those patients because we can take somebody who wears a removable partial denture in a very short time.
So they're headed for disaster too.
Well, eventually...
I mean, they're losing bone, their mouth might be collapsing.
The partial denture causes pressure on the gum, pressure on the bone, and eventually loosening of additional teeth. So if we can get those people in, we can take them, and many times we can either give them implant support for a removable denture, or we can throw the denture away. We can rebuild bone where we need to and place several dental implants. Now, patients who are missing many teeth don't have to put a dental implant in for every single tooth. We can have implants to support a bridge. Now, the benefit of an implant bridge rather than a tooth bridge is that implants do not decay. Those implants are solid in the bone, they don't move, and there's no danger of decay around the implant or needing a root canal around it.